Namaste, I am Dr. Amit Mishra, radiologist, Perfect Imaging, and in today's video we'll discuss about gallbladder diseases, some of the common problems associated with gallbladder. It is very common to have gallbladder diseases, as most of you have seen in your ultrasound reports. So I'll talk about some of the most common diseases associated with gallbladder. First, let me describe the entire structure of gallbladder and how it is located in your body. So, in the body, there is an organ which you have heard of. It is called liver, and it is located in right side in your upper abdomen. So, in your screen, you can see the image. This is liver, and in the liver, there is something called bile. So, bile formation occurs within the liver cells, and this bile flows through a tube-like structure which you can see in your screen. This is called bile duct, and this bile duct drains this bile, and the bile goes up to the duodenum. So duodenum is a small bowel, and the bile drains into it through this thin tube which is bile duct. And attached to this bile duct is another thin tube. As you can see, this is cystic duct, and the cystic duct leads to the gallbladder. So this is the gallbladder, and this is the entire structure which is located in your body. So this is the entire structure of liver and gallbladder. Now, the function of gallbladder is to concentrate this bile, which you can see on your screen. This, as I explained, the bile forms in the liver, and it is stored and concentrated within the gallbladder. So this is the function of gallbladder. Gallbladder does not in itself form any enzymes or anything in your body, but it just stores and concentrates bile. So this is the main function. So this is the entire anatomy. Now, the most common disease associated with gallbladder is gallstones. So most of you have heard that stones can form within the gallbladder. So this is one of the most common conditions which you encounter in your ultrasound reports. Some of you must have taken an abdominal ultrasound and would have been diagnosed with gallstones. So gallstones can occur at any age. It can occur in pediatric age, in children, or it can occur in middle age, it can occur in old age. So gallstones can occur in every age. However, it is less common in children, but it can occur in any age. So what are the symptoms of gallstones? So gallstones are mostly asymptomatic. So in most of the individuals, in most of the patients who have gallstones, they do not feel any symptoms. They do not feel any pain or any such thing. However, in some patients, gallstones cause pain, bloating, dyspepsia, these kind of symptoms. So this is about the symptoms of gallstones. Now, if you have gallstone, which are the tests to take? So the best test for gallstone is ultrasound. So ultrasound of your abdomen is the best test to diagnose gallstones, in which you can see the gallstone number, size, and rest of the gallbladder. So ultrasound is the best test. CT scan is not a very good test for gallstones because gallstones can be missed. They are radiolucent mostly, which means they are transparent to X-rays, and hence they can be missed on a CT scan. So ultrasound is the best test. MRI can be done, but MRI is complementary. MRI has its separate indications in gallstones. Generally, the stones which are seen in the tube which I described earlier, which is called bile duct, for these stones, MRI is very good. But for gallstones, still ultrasound is the best test, and it is the first test and the best test to be done for diagnosis of gallstones. So if you have a gallstone, what to do next? So if you do not have any symptoms, if you do not face any pain or any other symptoms, bloating, anything, you don't have any symptoms, so you can just wait and watch. You can just get your interval ultrasounds done in 4 months, 6 months, or in a year, and you can just see how the stones are progressing. However, on the other hand, if you have symptoms, you are experiencing pain, repeated bloating, dyspepsia. So if you have these kind of symptoms, then you can think of a treatment. Or if on ultrasound you have other features like inflammation in your gallbladder or thickening of your gallbladder wall, if you your gallbladder is contracted and stones are also there. So if you have these kind of abnormalities on your ultrasound other than the stones, then also you should think for a treatment. Now, what are the treatment options in gallstones? So, pharmacological treatment, medicinal treatment is not very effective. There are medicines for gallstones, but they are not very effective. For small stones, they can be tried, but the resolution is seldom seen. At least in my practice, I have not seen many gallstones to resolve completely, and there is a chance of recurrence also. So, medicinal treatment, pills are not very effective for gallstones. Surgery is the best treatment for gallstones. So, if you have gallstones and you need a treatment, so surgical option is the best. So in surgery, what we do is you remove the gallbladder. So gallbladder and the entire cystic duct, gallbladder, all this structure is removed along with the stones. So this is the surgical treatment for gallstones, which is the most effective treatment for gallstones. Now some questions which patients have, I want to answer those questions. So some patients ask whether surgery is required in an emergency, so we should take surgery immediately or we can wait. So that depends on your condition. If you are having severe infection in your gallbladder, you are having repeated infections in your gallbladder, and ultrasound is showing abnormalities like thickening of your gallbladder wall, inflammation of your gallbladder, so in that case you should plan an early surgery. It does not mean like you have to do it within a week or like that, but you should plan it as early as possible, because gallstones are causing symptoms, they are causing inflammation, infection. So it is better if you remove the entire structure, and so that is in those cases you should plan early surgery. If you do not have any symptoms but you still want to get your gallbladder removed, so in that case you can just take your time and you can plan the surgery. There is no hurry. So the timing of surgery will depend on your symptoms and will depend on your ultrasound report, whether ultrasound is showing some abnormalities along with the stones. So in that case an early surgery will be advised. If not, you have just plain gallstones, no other problem in your ultrasound report, and you do not have symptoms also, then you can wait and watch and get your surgery done according to your comfort. So that is one question. Next question that patients ask me: what are the risks of stone? So if you have, I am having a gallstone, what are the risks? Plain gallstones usually do not have any significant risk. There is a plain gallstone, there is no other abnormality in your ultrasound report, so then you can just wait and watch, because these kind of gallstones generally remain stable and you can just take interval ultrasounds. On the other hand, there is a risk that they can cause repeated infections in gallbladder, which can lead to swelling of gallbladder, thickening of its wall. That is one risk. Second risk, the gallstone can come down this tract which I showed earlier on your screen, this tube-like structures which I showed you. It is possible that the gallstone trickles down, comes down this tract, and somewhere gets impacted in some of these tubes, and that can lead to blockage of your bile flow, which will lead to jaundice. So that is the second risk that gallstone has. Third risk, if gallstones cause repeated inflammation, infection, because repeated inflammation, repeated infections increase the probability of gallbladder cancer. So that is another risk which we need to consider. However, there is no direct link between gallbladder stone and gallbladder cancer. However, as I said, repeated inflammations due to gallstone can definitely increase the probability. So that is another risk. Next question that patients ask: whether the surgery will be laparoscopic or open surgery. So whether it will be a less invasive laparoscopic surgery, as you all know, or it will be a open surgery. So that will also depend on your condition. If you have severe inflammation, there is a lot of inflammation around your gallbladder, or the gallbladder has in some cases bursts, and then there is a severe inflammation adjacent to the gallbladder. So in these conditions, your surgeon might do a open surgery. However, otherwise, in all other conditions, when there are no complications, then laparoscopic surgery is the preferred option. Next question that patients ask me, sometimes this is very frequent doubt: I had an ultrasound done. Some patients asked me, I had an ultrasound done, and I was diagnosed with gallstones, but when I repeated the ultrasound after a couple of months, they did not find any gallstones. So in that case, what I would suggest is, if the gallstones are small, then there is a possibility that they can be missed. So there are several structures adjacent to the gallbladder which are filled with gas. The bowels, they are filled with gas, and small stones, what happens in case of small stones is they track down and they settle down in the structure called gallbladder neck, which you can see on your screen now. So this is the gallbladder neck region in which the stones can come and settle down there, and in this case it might be difficult to pick on ultrasound. So in case of small stones, we need to do several maneuvers. We need to turn the patient on one side, or we need to make the patient sit. So there are several maneuvers which your radiologist, which your ultrasound doctor needs to do to correctly pick up these small gallstones. So there is a possibility that in case of small stones, they can be missed on a transabdominal, on an abdominal ultrasound. So that is one thing that you need to be careful about when there are small stones and it is not properly seen on ultrasound. Then your doctor will have very careful ultrasound to pick these small stones. So small stones require a very careful and a very specialist ultrasound. Next question that the patients ask me is the size of the gallstone. Like on previous ultrasound, the size of gallstone, let's say, was mentioned as 10 mm, and in present ultrasound it is mentioned as 8 mm. So has the size decreased, and is the gallstone dissolving? So it is not like that. So a few millimeters difference in size can happen in measurement during ultrasound. When we measure the ultrasound images of stones, there can be a variation in measurement. So that cannot be thought of as, that cannot be taken off as a resolution of gallstone or as a decrease in size. So a few millimeters change in size is generally not taken as any significant change. So these are some of the questions that patients ask me. So this is what I wanted to tell you about gallstones, which is a very common disease, and a lot of people are suffering from it, and they have a lot of misconceptions. So this is all about gallstone. Thank you.